Bone cancer explained by Biohacking Tips. Being one of the rarest types of cancer in the world, bone cancer is the least deadly one. With all its complications, bone cancer can be extremely aggressive, therefore, it should be detected early to avoid all of its harm. Because of its uncommonness, you might not be familiar with it. So in this video, we'll be telling you all you need to know about bone cancer, including its causes, types, and its treatment. So stay tuned and watch till the end. What is bone cancer? Your bones are not just hard masses making your body's framework, but are composed of layers. The inside area of the bones, which is soft and spongy, is called marrow, consisting of red blood cells, white blood cells, and platelets. Any of these cells can grow abnormally and uncontrollably, forming a tumor. Bone cancer is formed in the body through this tumor, which grows on the bones. If the tumor grows speedily and cells spread to the other parts of the body, it means that it is cancerous or malignant. This is called primary bone cancer. The difference between bone cancer and bone metastasis. Bone cancer is not very common in old people, and most of its victims are children, teenagers, and young adults. Because of the rarity of bone cancer, bone metastasis is sometimes mistaken as bone cancer. Now you may be thinking, aren't the two of those the same? Well, it's not the case. When bone is the primary location where cancer buds from, it's called primary bone cancer. But sometimes cancerous cells from other organs, like breast and lungs, spread and grow in the bones, which are called bone metastasis. In both of these cases, bones contain cancer, but here's why these are different. First of all, cancer is always named after the organ it starts from. And when it starts in your bones, it is called bone cancer. And the other reason is that the cells which migrate to your bones from other organs look like cells of that organ under a microscope. Hence, the two of them are not the same. Symptoms. Some of the most common symptoms you may notice include swelling. The affected area of your bone will swell, and it can also cause pain. This pain is sometimes so terrible that it doesn't let the patient sleep, and it is difficult to move. Mostly the tumor where the bone cancer is formed is on larger bones, like the femur or your limb bones. You may feel some hard mass in those areas. Because of any of these conditions, you may get fever and fatigue. Causes. One of the biggest causes of bone cancer is radiation therapy, or being exposed to any cancer treatment, which usually involves radiation. These high radiations can cause cancer in your bones. Similarly, some drugs taken during cancer treatment can cause bone cancer. Other causes of bone cancers can be genetic mutations and problems that are hereditary. Are you having a good time learning these facts? Then hit that subscribe button and give this video your biggest thumbs up so you could get more of these videos. Also, press that little bell icon to keep getting notified. Types of bone cancer. As we just told you earlier, the name of the cancer depends on where it starts from, and the types of primary bone cancers also depend on where each of them originates. There are 4 kinds of them, so let's have a look at them one by one. Osteosarcoma. This is the most common type of bone cancer, which forms in bone tissues when bones are in their developmental stage. That is why it is commonly found in younger people, including children and teenagers, and is very rarely caused in older people. Chondrosarcoma. Chondrosarcoma is the kind of cancer that occurs in the cartilage, a softer bone present between your bones and joints, supporting the movement. It is the least common kind of primary bone cancer. It is more common in older people as compared to children and teenagers. It can originate from any place in your body where cartilage is found, like your limbs, trachea, skull, shoulders, etc. How aggressive it depends upon how fast it spreads. There are 3 grades for that, out of which type I and D are the most common. Asterisk low-grade chondrosarcoma is the slowest to spread and is called type I. Asterisk intermediate-grade chondrosarcomas have a higher spreading probability and are called type I. Asterisk and high-grade chondrosarcomas spread at the highest rate and are referred to as type I. Ewing sarcoma. After osteosarcoma, Ewing sarcoma is the most common type of primary bone cancer known. It can be formed in the large bones in your body, like legs, hip bones, and shoulders. It can start in other organs and tissues, and can then develop in your bones, and is most likely to occur in people under the age of 30. Choroidoma. The most uncommon type of bone cancer is choroidoma, in which a tumor is formed at the base of the spine or the skull. It is most common in adults. Compared to women, men are more likely to go through it. Treatment. Before bone cancer is treated, doctors go through the process of grading, which is done through biopsy. In this process, doctors grade the tumors to know how fast the cells can spread and how dangerous they can be based on their resemblance to normal cells. They may be low or high grade, and by their detection, doctors find out the best treatment for them. Other than biopsy, in which bone tissue will be examined under a microscope to find out the problem, the best methods to detect bone cancer or any other cancer are magnetic resonance imaging and X-rays. CT scans are also required before the treatment begins. After grading, there are a couple of things that are kept in mind before treating the patient. These include the location of the tumor, the patient's health, age, and of course, the grade of the tumor. Once they're found, they can be treated in a few ways. Surgery. Surgery is only done when cancer reaches a crucial stage and the tumor has to be removed surgically along with some healthy tissues. Sometimes an entire organ is removed and replaced by a prosthetic. If doctors fail to remove all the cancer cells, then a repeat surgery is needed. Chemotherapy. Chemotherapy involves the killing of cancer cells through medicine, which is either taken by the patient in the form of pills or injected into his veins. It can be done to cure any grade of tumor in the case of bone cancer. Radiation therapy. This is usually done before surgery, where tumors are exposed to radiation so that they could shrink. In that way, lesser healthy tissues would be removed from the body. Before we end the video, you should know that most of the people who get bone cancer recover successfully. It is not extremely fatal in most cases, but every case is different, and therefore, some patients are not able to make it out alive. By early detection, it can be treated on time, but the chances of survival are decreased after a delay in its diagnosis. Subscribe to this channel if you haven't yet, and we'll see you guys next time.